And good morning, everyone. We'll get started in just a couple of minutes, giving a few more people the opportunity to sign on. Thank you. All right, good morning. It's 10:05, so I'm going to go ahead and get us started. As always, we've got a lot that we want to share, so I'm going to get us started. I am going to go over a few things that's on my slide, and then I'm going to actually turn it over for a presentation from CDPH. And so I'm going to go ahead and jump in. Good morning, everyone. Happy pre-Friday. I'm glad you're all are here with us this morning and we're able to take some time out of your very busy day. I know how hard it is and with everything going on to give up a couple of hours on a Thursday, but we thank you for being with us. So my first one is to give you a class update for those of you who have our federal Head Start. You've been involved with our class review since February 14th. We are a couple of weeks out from the end. It ends on April 8th. We are halfway there, over halfway there as far as, getting everything submitted. What we have been doing along the way is doing the class observations, but we're also doing some other observations in classrooms and doing some TNTA. And so what we're going to be doing is we're going to continue to do some of this work after class is over because of some of the things that we're able to see when we're looking at videos. And we really do want to do what we've had an opportunity to do here, which is really provide some TNTA and support teachers because some of the things that they're trying to figure out really is when it comes to doing, active supervision, that's one, but also ensuring that they're using the curriculum across their day. And so we're going to continue some of this work after our class observations are done. Again, class is almost over. We've got a couple of weeks left. Our last day for the class review will be April 8th, and then we anticipate receiving a report back from Office of Head Start between 6 to 8 weeks after the close of that review. I know some people have been waiting, and I just want to give you an update on the doula PIRFP. I'd said before it was going to launch. It is now still held up. For those of you who have contracts, you know that we've done some changing in our insurance, and there's a new system for your insurance that has to be embedded in the RFP. So we're working to embed the changed language regarding insurance in the doula RFP. Once we're able to successfully complete that one, we will be able to get that RFP launched out on the ground. And as soon as I get the okay, then I will be sending out emails to folks letting you know that the doula RFP is up and it is live so that people can actually apply for that program model. CARES, we are winding down. I know for those of you who've been on this ride with us for now 2 years, and the words of winding down is like, can it be so? It is March 2024, and we had anticipated having everything completed by the end of this month. We do have one module we're still finalizing for those of you who have our CCAP grant. We're embedding what normally had been in COPA for CCAP into our CARES system. We're finishing that, and there will be training on CARES module in April. And so we will be still doing some trainings. We will definitely be finishing the CARES model, the case management, and all of that for those of you who have our CCAP funding. And then we will be doing some additional training throughout April. There's a couple of dates that we're going to have some office hours, so that information will all be coming out to you. So there's going to be more enrollment management training. There'll be more case management training. There'll be a couple of days that we're going to do office hours, and we're going to try to make sure that everyone who needs to get trained has had an opportunity to do it before we finished the month of April. And so more information is going to be coming out about training days for CARES to make sure that all of your staff, based on their roles, have had an opportunity to get trained. Because again, once we finish this last module, which is CCAP, we are going to be pulling down everything from COPA. HR, we're going to be pulling over another data set from there. HR is already complete in CARES, and we're going to be getting the last data set. And then that will be your system of record only. From CCAP all the way through, everything will be done in CARES. And so we're trying to bring this puppy home in the next 30 days or so. And then we'll do some final touch-ups and some final communications with you about the system. But we are finally there, and it's been a long haul, a couple of years of up and down, but we're here now, where CARES is going to definitely be our system of record, and COPA will only be used for archiving data. It will no longer be used for HR, for CCAP, or for any of that. And once we get there, everybody will get notification letting you know that you can no longer access COPA for any of your pieces of your data. It will all need to be done in the CARES system. So look out for more information on that. Chicago Early Learning application will launch on April 9th. It is the entryway for children and families into our early learning programs. And I just want to make sure that everybody understands, parents all need a application done. In order for them to receive their CPS ID number, they need to get that application done. So we're going to be doing some other trainings. We'll be out and about, doing everything that we can to make sure that everybody has the level of comfort with using the application, to make sure all parents are applying through the application system. If they don't have a CPS ID, for example, and you have early childhood block grant, we can't count your children. We have quite a few children right now that are in programs that don't have CPS IDs. What that also means for parents is this: they will have been in your programs, they'll transition off to kindergarten if they're in their last year with you, and they won't have a CPS ID. That mother has to have one in order for her child to enroll in CPS. The CPS ID that they get once they do the application, that ID number follows that child as long as they're in the CPS school system. So it will go from birth to 3 all the way through K-12. But we need to make sure that every parent has that CPS ID for their child. And so, you know, we want to make sure that everybody is working with the system. If there's more that people need, they need to let me know. We can do trainings, we can help, we can support, but every parent needs to have that application completed. Regardless of funding and regardless of model, you need to make sure your parent has that application completed so it can generate that ID number for the child. Couple of things that I do want to make sure that you guys understand. There is still the information out there, 407, Rule 407, which is your licensing standard. There's right now a comment period for some of the rule changes that they're looking to make. If you've not made comment about those rule changes, you still have an opportunity, very short window, but you do have an opportunity for yourself and others to get those comments in. DCFS.policy@illinois.gov is where you can go and actually leave comments regarding what is proposed amendments to Rule 47. If you've not, and there's something in there that you want to comment about, you want to do that quickly, because they are planning to start the process by early April of making sure that they can wind this up and begin to get it through rule. Again, if you want to comment, you got a really short window right now. Here's an opportunity for you to comment on the new proposed rules for that child care licensing standard that you are living through for center-based care. So just wanted to make sure that you're reminded that that is coming up. I'm looking at chat. We do need to talk. Yes, and there's a question in the chat box, and it is around the CPS application. The question is, Does the application have to be done in Schoolment? Yes, it is a Schoolment application. And that's the Schoolment application that links directly to CPS's Aspen system. And that's where that CPS ID will be generated from. And so again, we do need to make sure that everyone has access and the ability to make sure that their parents are actually going through that Schoolment application. And I'm looking at your comment, and if you're having issues and you need some additional assistance with that, please, you can put a note in the chat, or you can email me, at my email address, and we will follow up and make sure we get you some support regarding the Schoolman application process. So I'm going to finish my updates here, and I am going to, go ahead and invite, Allie, who is with CDPH, who's going to do a presentation this morning with you. As many of you have heard and know, I'm going to skip that slide. And I'm going to go right into this and give you an opportunity to unmute, and do your presentation. And I want to thank you for being here this morning. These are our executive director, program directors, and staff of our funded early learning programs across the city of Chicago, both federally funded and state funded agencies. So again, I welcome you. Go ahead and unmute, and you can get started in your presentation. Thank you.
Great. Awesome. Can everyone hear me? Thumbs up. Great. So hi, my name is Allie Sontag. I am a nurse practitioner in the Office of School Health here in our MICA Bureau, which is Maternal, Infant, Child, and Adolescent Health at the Chicago Department of Public Health. I am a native Chicagoan. I have a child in daycare right now. So I want you all to be informed about what's happening with measles. So we'll jump right in. Next slide, please. So just to ground ourselves in the mission and vision here at the Chicago Department of Public Health, our purpose is to work with communities and partners to create an equitable, safe, resilient, and healthy Chicago. And the impact we seek is that everyone in Chicago thrives and achieves their optimal health and wellness. And I truly believe nowhere is that more true when we're talking about our children. Next slide. So we're here today. There are measles cases in Chicago. We're going to go through what measles is, what this means, what the process is if there is a measles case, things we can do to prevent and protect as much as we can. And then I'm going to have it, feel free as we're going through, put questions in the chat. I will answer them either as I'm going through the presentation or at the end if we have time. So what is measles? Measles is a highly contagious acute viral disease. Outbreaks happen when unimmunized people become infected and then infect others who are not immune. It can also be called rubiola, which is like an older school name, but you may see that somewhere. And it spreads really easily and can be very serious and even fatal. Over 200,000 children's deaths per year, and deaths per year occur related to measles, and it's mostly in children. And the best way to do this is to prevent it with the MMR vaccine. We have seen so much more measles worldwide. So it does feel like we're having a Chicago crisis right now because we are seeing measles here in Chicago. But know that this is a reflection of the larger measles spread throughout the world. The UK has seen 36 more times measles cases than they have in the last 10 years this year. We're talking about throughout the world. In fact, CDC put out a global health advisory about children traveling abroad, making sure that they're vaccinated for measles, and adults make sure that they're fully vaccinated for measles, because this is not a Chicago problem. This is Chicago's problem is representing a larger global issue, specifically around measles, which is unfortunate because in 2000, measles was declared not eradicated, but no longer endemic in the US. And so we are now seeing measles come up again. Go back one slide for me. So signs and symptoms. You are not clinicians. We are not asking you to be clinicians, but we do want to just flag for you some of these classic signs and symptoms because we don't see measles a lot. Or recently at all, right? We've had a handful of measles cases in the last 10 years. So I've never seen a measles case transparently, and I'm a nurse, right? So just want to flag for people signs and symptoms real quick. It presents with a fever and then something we call the 3 C's, which is cough, coryza, and conjunctivitis. Coryza means a runny, stuffy nose. This looks like everything else, right? 3 days later, they might have these little white coptic spots. which is demonstrated in the back of the throat there. And then 3 to 5 days after those first fever and the 3C symptoms, you see the rash. And the rash is what we think about with measles. Measles is a flat red rash. It starts at the hairline and it moves its way down the body and on the hands and feet last. So this is going to be our real red flag, is if we have rashes and fevers in combination. So also kids get rashes all the time, right? You work in early childhood, fifth disease, kids are rashy. So this is just also another reason for us to just pay attention and make sure we're getting those kids evaluated. Next slides. Transmission, so the incubation period. So after someone is exposed to measles, it on average takes about 14 days for them to actually develop the symptoms of measles, those first symptoms, which is fever and the 3Cs. It can take up to 21 days. And this is because how measles works as a virus is, in order for it to make someone sick, it actually infects their immune system. And so it has to go all the way inside the body. So, like COVID, right? It takes like 3 days to start showing symptoms most of the time. And that's because it's in our nasal cells and it just causes upper respiratory congestion, those kinds of things. And so it's a localized infection in many ways. Measles is a whole body infection, and you get infected and then it goes all the way through your immune system, and then you start presenting with symptoms. So it takes a while. And people are contagious 4 days before the rash starts, right? Oftentimes with those first symptoms of fever, cough, runny nose, right? Which looks like everything else. And this is also what makes it so contagious. Because what until you have the rash, you don't really know that it's measles. So next slide, please. So this is the thing to remember. So the contagious period starts 4 days before the rash. And this is important for us to remember because this is about exposure, right? So if there is a case of measles, let's say I get measles, I get a rash on Tuesday. This means that I have to go back 4 days from when that rash starts. And I'm looking at people that I have exposed in that 4 day period before. And then people are contagious 4 days after the rash starts as well. So you are, so for, just so remember, so this is the minimum contagious period. And this means that most of the time people don't even know that they
My
are.
leg feels better.
Next slide. So transmission. The other reason we like to talk about measles and people are on high alert is because it's an airborne virus. So COVID is something called droplets. And that means that you generally have to pick up those little droplets on objects, that it's not in the air that you breathe, right? Measles is the particles are so tiny and they hang in the air that up to 2 hours after someone who's contagious for measles has left the room and someone who is unvaccinated goes into that room, they can catch measles. So it is also very contagious in that sense, that it can just simply being in a space after the person has left can transmit measles to the next unvaccinated person. So up to 90% of people who are exposed to measles, if they are not vaccinated, will become infected. So it's a very, very contagious disease, and it behaves in a way that the spread is very hard to control because it's airborne and it stays in the air after the person has left. Next slide. How do we diagnose it? Again, you're not a clinician. I don't expect you to memorize this, but just know that it's not something you can diagnose on site. That while we have lots of clinical suspicions, right? Your fever, 3Cs, rash, all of that needs to be evaluated. Providers need to be sending in lab tests. And so it's a nose or a throat swab. They can do blood tests, but there's a lab result that tells us that someone has measles. And that result generally takes 24 to 48 hours to get back. So if you send a family, to the doctor and you're like, we want to make sure that you're evaluated for measles. And you're like, what are the lab results, right? Did they give you a lab test? Did they test you for something? Those are important questions to ask. Next slide. Treatment. So this is the other really frustrating thing about measles. There is no treatment. It's a viral illness. And so there's really no specific treatment. We can manage symptoms like managing the fever, rest, fluids, everything you would do for a cold. But it really is just the waiting game and for recovery. Next slide. So what do I do? So you have a lab confirmed case. Family went, they got tested, lab results come back and it says measles. What do you do then? So it's exclusion for the person who is positive for measles for 4 days from the start of the rash. So that's that contagious period we talked about. So once that rash starts, they have to stay home for 4 days because they are contagious. We ask that you not send out notifications until you talk to us. Families often are going to panic. I've had a lot of people say, oh my gosh, it's a measles diagnosis. CDPH will call the provider and it's eczema. And the family just panicked and they listed measles in the differential, and that's what they tell. So please let us confirm with the provider. The providers call us back. They have to report measles within 24 hours to the state anyway. We get that notification. So if you have a family who's like positive for measles, you call us, we'll call the provider. Every case of measles is investigated and contact traced because it is a vaccine preventable illness and because it can make people so sick. So don't send out any notifications until we can confirm. We work very hard to confirm this in a very timely manner so that you are communicating with your families in a timely manner. So we'll verify and then we'll share a notification letter. We have it written, we have it translated into multiple languages that you can share with your community once we've confirmed that it is a lab confirmed case of measles. Reporting. This is a single case reporting. If you get one case of suspected measles, you call us and you need to call us within 24 hours. This is a state requirement under the public health code. Healthcare providers are also required to call us within 24 hours. And then if the healthcare provider calls us and you haven't heard, we will be calling you to notify you when we hear of a measles case that is involving a daycare. Next slide. So what do we do for close contacts? And this is called post-exposure prophylaxis. So a few things. If you're a close contact who is vaccinated, you're fine. Vaccines are extremely effective against this. Now, we're concerned about the people who are close contacts who are not vaccinated. And there's a few things we can do in that case. So people without immunity, so this is generally kids, once they turn 6 months, we actually can give the MMR vaccine. We wait until a year for it to count towards their regular pediatric vaccines. But if they're 6 months and older, they can actually get the MMR vaccine in this post prophylaxis, right? So if they're exposed and they're 6 months or older, if it's within 72 hours of the exposure, so the last time that they were in contact with someone who might have measles, if it's within that 72-hour window, we will vaccinate them. So this is infants, 6 months and older, or adults who are unvaccinated. If we can vaccinate them within that 72-hour window, they're protected against the virus. There is also something called immunoglobulins, which we can give, which is basically a protective, it's all of the stuff that our body makes when we get vaccinated, except it's distilled down and given to the person if we can't vaccinate them. And that really is for pregnant people and then children under the age of 12 months and people who are immunocompromised. So if we don't think they can raise an immune system or we can't vaccinate them, we'll give them immunoglobulins. This will just prevent them from getting severe illness. They still might get it, but ideally we vaccinate, and we cannot vaccinate pregnant people with the MMR vaccine because it is a live attenuated virus, which I think I cover on the next slide, please. Okay, so susceptible contacts. So close contacts, right? We have our susceptible close contacts. These are the people who we're going to exclude. So any exposed students or staff who cannot prove immunity must be excluded for 21 days after their exposure. And that's because that's how long it takes for that virus to potentially make someone sick. If you have proof of immunity, you get to come to school, right? So this is a documentation of 1 or more doses of MMR. Right? So if we think about it, we know kids starting at the 12 months will get a dose, then they'll get a second dose around 4 years old or older, 4 to 6. They have at least 1 dose of MMR and they were exposed. They're considered as proof of immunity. They can come to school. If they have lab evidence of immunity, this means that they have blood, they draw the blood and we check their levels and it shows that they have some immunity, they can also return. And the last one is that they've had measles already. Very rare here, but not impossible to have had measles. And then we do want, if they have the one dose, we do want to redose them with a second dose 28 days later if possible. There isn't that exception we talked about, right? So anyone who's unvaccinated, who's a susceptible close contact, if they got that vaccine within 72 hours of the first exposure, then that is their proof of immunity. If it's past 72 hours, it does not count as proof of immunity if they were unvaccinated previously. We'll work with you on this. It's a little messy. But providers we're working to get them more comfortable with this too. Next slide. So what do you do if you suspect a student has measles, right, while they're in your daycare setting? So you're going to ask yourself the following questions. Does the child have a fever and a rash at the same time, right? That's a big red flag. And then does the student have a connection to a known measles case, right? Was there a case recently? Was there a case in their community? And then is the student unvaccinated, right? Do they not have at least that one dose of MMR? If they have any doses, just record it. Now, things to remember, even if all of these things, only one of them are true, follow your standard return to school protocols, right? If a kid has a fever, they go home, period, right? Even if they're vaccinated, even if all of this, right? Remember, just because we're looking out for measles with a closer eye now doesn't change the fact that strep throat is going to come around again, that norovirus is real. So make sure that you're just following your standard protocols, but we're asking you to add on additional questions about rash and vaccination status because it is so contagious, right? If you're concerned that it is measles because you asked yourself these questions, you want to immediately put the student in a private room with the door closed and open some windows if possible. You want to make sure that any staff interacting with that child is fully vaccinated, right? So that they're not going to get sick. We want to mask the child, call the parent for immediate pickup. We want to, when they leave the building, you want to make sure that you're not walking them through immunocompromised kids on the way out. And then you want to close that room off for 2 hours after they're in there. Like we said, remember, it hangs in the air. You want all those particles to fall to the ground and fall out of the air before we open it back up. And then you're just going to do standard cleaning and disinfection. So once that 2 hours have passed, it's no longer airborne. And then you can go through a standard cleaning and disinfection protocols using your EPA approved products. Next slide. So prevention, like I have hinted at throughout this whole presentation, the best thing we can do to prevent measles is to make sure that we are vaccinated. So MMR vaccine, it's one dose on your first birthday. For preschool, it's the second dose, K through 12 at around age 4 to 6. It is a live attenuated virus. This means that the virus is killed, but it also means that we cannot give it to pregnant people because a pregnant person who is not allowed to get live attenuated viruses. It can be given at any age if someone isn't vaccinated or doesn't remember if they're vaccinated, thinking of our newcomers who may not have documentation. The protocol is to just restart vaccination. If you don't have documented proof of immunity, we'll just revaccinate you. The MMR vaccine works unbelievably well. It is why we were able to say in 2000 that it was no longer endemic in the US because we had such good vaccine coverage. If you're vaccinated with MMR, you are 35 times less likely to get measles than someone with no immunity. And it's so effective that at one dose, you have 93% protection. And at 2 doses, you have 97% protection. This is, for vaccines, this is like the top. Like this is great vaccine protection. Also calling out though, some of our kiddos can't get vaccinated, right? They're not one yet. And that's really where this challenge comes in for the early childhood setting that is unique to the rest of the school setting. So next slide. So this is where herd immunity comes in. And this is when it becomes really important that everyone around the kiddo who can't be vaccinated is vaccinated. So for example, in my household, my child is under the age of 1. He has not gotten his MMR vaccine because he's not eligible yet. It is important that I am vaccinated, that my spouse is vaccinated, that everyone who's around him is vaccinated to the greatest degree possible. Because if I'm vaccinated, I'm less likely to get it or spread it to others, right? Is it possible for a vaccinated person to get measles? yes, it is very rare. It's a breakthrough case. And it is generally because that person may not have raised an immune response the first time for whatever reason when they got vaccinated. Yes, the PowerPoints will be available. They can be sent out. We're also going to post them to our website with our guidance, or I'm making a one pager to send home to families. We're working on getting it translated. But yes, they will be available. So herd immunity, super important. Surround that kid with protection. For measles, we want like 95% of people around the kiddo to have herd immunity. That may not be realistic, right? In a classroom that's all under one, we only have the adults be immune, right? So we want to make sure that everyone else who comes in
Según
contact with that child
que lo,
is protected. Next slide.
no,
Unless
that's
they-
Ron was laughing.
Please, excuse me, please mute everyone. Thank you.
So where can families get MMR vaccine? You've got kiddos over 1 who aren't vaccinated. You have adults in your life who aren't vaccinated. Encourage them to get vaccinated. FQHCs, federally qualified health centers, are my #1 choice to send families to. Great question. For adults who are vaccinated in infancy, you're good. This is, you get 2 doses your whole life and you are covered. We don't think protection wanes over time. Most people continue to be protected their whole life. Sometimes you'll do blood titers to check for immunity. For example, in pregnant people, right before they get pregnant, we check to make sure that their blood levels are good for MMR and these kinds of things. So yes, you just get vaccinated as a child and you're good for your whole life. Pharmacies, they generally don't vaccinate kids under 2, so it depends on the pharmacy. We have CDPH vaccine clinics, which offer vaccines at no cost. We don't request insurance, ID. This is a great place to send families if they are struggling to get connected to care. We vaccinate everyone. And then the Vaccines for Children's program, which is a bunch of local clinics will follow this, but it provides free vaccine to kids. Next slide. So here is a bunch of vaccine resources. VaxVerify is a way for families to request their vaccine records from iCare from the state. The Vaccines for Children's program, which is the no-cost vaccines for kids. You can look at the provider search. We have our vaccine clinics and an FQHC finder. We have some CDC resources linked here that we will make sure we send out. So how to contact us if you have questions. Step 1, if you have a concern that you have a case of measles, follow this reporting protocol. Call us whenever, 24/7, right? You think you have a measles case? We want to know. So during work hours, you can call that number. If it is outside of working hours, you can call 311 and ask for the medical director on call. If you are calling 311, if you want to call Chicago 311, but you are not in the city of Chicago, you live in the burbs, this is the phone number to call because you have to be inside city proper for 311 to get connected to City of Chicago. If you just have a question about measles, reach out to us. So the Chicago Department of Public Health Communicable Disease has a youth settings program, schoolcd@cityofchicago.org. You can call us. That's our phone number. Also, we're trying to keep the Chicago HAN updated. We have a health alert network and we've built out a measles page. I'm working today to get that updated with all of this new guidance. This is going to be where we're directing people. I'm going to put the presentation up there. I'm also going to put all of these links. As stuff comes up, we're going to try to keep that as updated as possible for schools. Next slide. And then general prevention. So we talked about this, right? Measles, really the thing we can do to prevent it is MMR vaccine, right? And if you're not vaccinated, we need to make sure people are staying home when they're sick, doing the things we know. Just like to end our presentation talking about general prevention. Norovirus is on the rise in Chicago on top of measles, right? Yeah, there's a lot of noro going around right now. Strep is creeping up, not as high as it was last year, but strep last year was really rough in the spring. So we want to be thoughtful that might happen. We might see that trend again. So on top of everything we talked about today, please remember just the standard general infection prevention work, right? Staying home when you're sick, keeping kids out until they're fever-free for 24 hours without the use of fever-reducing medication, quality hand washing, increasing ventilation, cleaning and disinfection of surfaces, and then for measles particularly, right, making sure everyone around that child is vaccinated. Next slide. And that's it. I really appreciate the opportunity to come and talk to you all. The school's CD email is in the presentation. Please feel free to reach out. If you have questions, throw them in the chat. I will hang out in the chat for a few minutes if people have questions, and I can answer it in the chat. Yes, I will put those in the chat.
Thank you so much, Ally. All right, we're going to move ahead. Go ahead. I go back to my second slide, and then we're going to go to Sheree's slide. Sorry about that, everyone. So one of the things that I wanted to make sure that everyone knew, the update regarding the end date for level 5, BA with level 5, for those of you who have state funding that requires a Pell or professional education educator license in your classroom, and that we have had an extension to the ability to have your teachers be in those classrooms with a BA. They also have to have the ECE credential level 5 that's awarded by Department of Human Resource Services, which is Gateways to Opportunity. Now that is able to go through school year of 28-29. So we've got another extension on it. But what that means is we need to get people back in programs. We need to get your teachers who have not gone on to get themselves on track for their professional educator license. There's more time. If you've got a new BA teacher who you are thinking that needs to go through, know that there's still scholarships available, there's still opportunities, and now we have a little bit more time to allow individuals to go through the process to get that credential. So I just wanted to make sure that everybody had that so that we are not missing the opportunity of getting our teachers credentialed so that they then are able to be in your preschool for all classrooms. And so just wanted to make sure that you got that update. So thanks, everyone. Go ahead now and go to Sheree's slides. Thank you.
Good morning, everyone. Sheree Johnson, Manager of Program Operations and Quality, Children's Service Division, DFSS. As our standing agenda item for every EDPD meeting, I'm here to provide you guys with an update on everything related to new arrivals. As we know, DFSS facilitates approximately 23 now shelters across the city. 14 of them are family shelters. So here's our update regarding where we are with new arrival enrollments. So to date, as of the 1st of March, we have approximately 1,631 children aged 0 to 5 in shelter. Previously, in the month of February, as of February 1st, we had 1,853 children aged 0 to 3 in shelter. So the numbers are decreasing. But we still have a number of children that are in shelter that need our support. As our standing agenda item I have here on the screen, if anyone would like to support the new arrival mission, you're welcome to click the link at the bottom of the screen there where everything is listed there regarding large donations, monetary donations. If you like to purchase multiple items or at least one item off of an Amazon wish list that is very specific to the needs of families that are in shelter, you're welcome to visit that link to get additional information. Next slide, please. So here we have our list of our current family shelters as of the 1st of this month. As you can see, we have one shelter, the 4th down from the top, CVS Little Village. It's our newest recently added shelter located in the South Lawndale area. Another update that we have recently began to do is previously we would group each of the age groups from 0 to 2, and then we would have 3 to 5, but now we're diving deeper into our data to be more specific to provide everyone with specific numbers as it relates to each age group. So you can see here on this slide, according to shelter, the number of children from 0 to 5, and including pregnancies that are present in each of those shelters. So for those of you who I am in current conversations with, and I know many of you have reached out inquiring, whether you can get on site to provide some on-site recruitment of families. We're ensuring that, of course, safety is top priority for not only the shelter staff and the families in shelter, but we also want to ensure that your staff are safe going into shelter. So due to recent health events. We want to ensure that all parties are safe across the board, hence my delay in contacting you back. However, we will be, following up with many of you who have gauged interest in coming on site to provide recruitment and materials to the families in shelter. Next slide. So previously we had reported these shelter locations as open and operating, but as of the 1st of March, the following shelters are no longer operating under DFSS. So I'm saying under DFSS because, if someone were to drive by one of these shelters and they're like, oh, well, I still see families there. It could be that these families or these shelters are operating independent of DFSS. So that's why I want to really highlight that under DFSS, these are no longer one of the shelters that were under the DFSS new arrival shelter umbrella. So the 3 sites that I would have promoted last month would have been Casa Esperanza, North Park Village, and New Life. Again, those shelters are no longer open and operating under DFSS. And just to give you all a running total of how our recruitment efforts have been, since October is when we started tracking the data related to CBO enrollments. I do understand that there are a number of CBOs who may have been doing enrollments on their own independently, and that's fantastic. This data that I'm presenting are those CBOs whom through DFSS and our collaboration have introduced to the shelters. And so this data is only based off of what those CBOs that I have been working with here at DFSS. So to date, as of March 1st, we have enrolled 664 children 0 to 5, be it in center-based programs or in home visiting, which is fantastic. As you can see, in the month of February, our enrollment slowly dwindled, and that is due, based off of what I've seen, due to staffing at CBOs, as well as, recent health issues that have occurred. There have been a number of illnesses, as we just heard through CDPH, a number of illnesses that are prevalent right now. So that is definitely impacting our ability to have staff go on site to do the recruitment and enrollment, but we're still here. We're still here, gauging the interest of CBOs. We're still, as best as we can, introducing those CBOs to family shelter staff so that you guys can get on site to do your recruitment and enrollment. So I know I can name at least 5 organizations who I know are like, Sheree, you didn't hit me back. You didn't hit me back. I promise I'm going to contact you today to follow up to let you know where we are with your recruitment event. But if there are any other organizations that are interested in going on site to do the on-site recruitment and enrollment event, please reach out to me. My email address is on the screen. I'm going to check the chat to see if there are any questions. Please share CCAP eligibility policy for new arrivals. And thank you for that, Annalyn. For no matter how a family is funded, if they're funded through federal funds, if they're funded through state funding, if they're funded through CCAP, which is another form of state funding, there are policies that are embedded in each of those policies and procedures regarding supporting homeless families, new arrival families, though no matter where they're coming from, Venezuela, they could be coming from a neighboring state, they could be coming, or they could be already here in the city of Chicago. If they are homeless, there are categorical eligibility factors in place that state that if a family is homeless, that programs can work with that family without considering income. They are already deemed eligible for programming based off of them being homeless. There are some stipulations in place specific to CCAP. They have to fill out a homeless questionnaire, which is available online. I'll be sure we can send that out in a CSD update. And prior to the end of this meeting, I could drop the link in the chat. But depending on how they're funded, there may be a specific document that must be completed and placed in the family's file. But those families, no matter what their income, since they are homeless, they qualify for care, and that care will be free for them because of their homeless status. So we'll be sure to share that out. Let's see. Yep, CSC update. Reach for the Stars Initiative. Okay, so I'll drop my email in the chat. And if there are any other questions, feel free to drop them in the chat, but I just want to make sure we continue on with today's presentation. Thank you, everyone.
Thanks, Sheree.
Good morning, everyone. This is Mertice Brooks, the supervisor for communications and planning. So you know what time it is, everyone. It is self-assessment time. Don't pout, don't cry. You know you have to do it. So all agencies, regardless of your funding stream and your program models, you have to conduct this program self-assessment. And please remember to include your partner sites. We only want one self-assessment for the entire agency. When you're creating your self-assessments, be sure that you are completing this with a team of people. This will include your policy committee, your governing body, your agency staff, partners, and other important internal and external stakeholders. Everyone did receive these packets via CSD updates. So if you are not receiving the updates, please send an email to Mara Martinez. Mara, could you drop your email in the chat? We may have some new staff on board who may not have received it. And be sure to follow instructions because my handy dandy Berenice Vargas will return your self-assessment if instructions are not followed. That's all that I have.
Thanks, Martise. Greg?
Good morning, everybody. You know what I'm going to say, but here we go. So it is time for, it is past time for us to, I'll be focusing on submitting the program information report. As you know, all federal funded, that is Head Start and Early Head Start agencies need to submit an annual report detailing all of the children that they have served, their eligibility, what services were delivered to them, family partnership, all kinds of information. So it takes a while to pull that together. So in November, if you remember, we created this year's PIR data collection forms and shared them with everyone via our internal CSD OneDrive. So everyone at this meeting should be familiar with that and be working to get that information in. You know, in previous years, we were able to get not all of it, but a certain amount of information out of the COPA system, and we have been working on developing a new system within CSD Cares that will eventually produce that report or large elements of that report based on the information being entered. But at this point, we still need you to go and submit this via those Excel forms. We need a lot of that information now, not just for submitting the report at the end of the summer, but in terms of gathering information on program services and children and families to prepare for the upcoming federal review. So when we released that to everybody in November, we sent out a set of expected due dates, which you're seeing here, for when we needed certain pieces of information in. Now, obviously, as children continue to enroll, we need to continue to go back in and add the new children and their information. But for children who have been enrolled since 2023, where our expectation is all of their information is on their spreadsheets at this point. So in December, we wanted to have the children who were enrolled at that point, all of their names and eligibility information and so on entered. And then by the end of the month, what class they were in, who's the teacher and so on. So that was the class data tab. And so then January's task was to be submitting the HR information, and on an ongoing basis from then through now, we wanted to be collecting the family data tab and disabilities information. And then we're now into March where we're looking for the health data to be entered. So if you have anybody, again, who is being served in your program, but you haven't entered their information on enrollment tab, please go in and do that. The due date, again, is last year for that information, because we are making other planning and we are using that information as your enrollment. So if you are reporting to the monitoring teams when they call and ask for your enrollment, you're reporting, let's say, 40 children enrolled in early Head Start. And when I look in there and I only see 25 names on the PIR spreadsheet, we are very concerned about that. And so we do need those other 15 kids in there basically this afternoon. So that's where we are with this process. Again, we've been sending out individual agency emails, and you've gotten a preliminary review of your data and expectations for corrections as we move forward. So if you have not heard from us yet, please look for it in the upcoming month. I think we got everybody, but we will be in touch again. So you'll be hearing specifically what those discrepancies are and which information we need. So as we outlined in the schedule above, we need you to work with your staff and to continue to put data in. While the report in its entirety isn't going to be reported until August 31st, that doesn't mean that you have until August 31st. That we have to compile this and error check it and follow up and so on. So we need this information again on the schedule that's there so that we have everything and can have a preliminary look at the end of the school year and then follow up over the summer to get any corrections or additional information we need. So again, I know it's a big haul. I'm hoping that we are not going to have to do it this way next year because you'll all be putting all of your children in CSD cares at the beginning of the year, right? Right. So thanks a lot for what you're doing. And again, I know it's been hard work. If you need any help getting that information in or have questions about what you need to do, please contact me personally or my team. With questions about that. And again, one other thing in the PIR, you will have noticed that we added monthly attendance spreadsheet tabs to the end of the PIR. You will also notice that you can't enter attendance information on anybody who's not already on the report. So as moving forward, we're going to start to use this to gather enrollment attendance information. We need everybody to be in there. So again, thanks for your work, and let me know if you have any questions. Back to you.
So this is Angel Jones Dotson. I am the manager for program admin. And I know on here I'm about to talk about something that Frederick will correct me if I'm wrong or if I mishap or misspeak on anything. But I know that this is the time of the year where it is important for you all to be thinking about budget revisions. And so I am offering my service if you need thought into it, or you want to brainstorm about it, or you just want some second, well, I wear glasses, 4 set of eyes over it. I don't have a problem with that. And one of the things that I've noticed from last year is sometimes you all lose money in a salary line. And so some of the process going in your budget revision this year is if I have money for a person's salary who I have not hired, and I have a 12-year contract, and for all intents and purposes, it's April, and my contract ends in June, and I know I'm not going to get anybody on that first or any of the payrolls in April, then I want to subtract all that money except for May and June, because I may be in a hiring process or whatever, and I want to move that money to another line item, just so I don't lose out on any money. So I just thought I'd put that shameless plug out for budget revisions, because this is definitely the time to do it. And I know that finance will go over the exact last due date for that. But this right here, I wanted to be able to explain. So I know that normally you guys are used to receiving a finance letters. However, some said that the finance letters were not detailed enough. So this is actually a sample. And it's a cut and paste of what is going to be given out to you going forward. This is actually something that will allow you to see what invoices DFSS sees in the system for you. And I would just like to go over it just briefly. Of course, it will have, your pertinent information on it, meaning the agency name and the funding source. So forget that this doesn't say this. And it'll also tell you, as you can see at the top, the date that it was printed. So you'll know it's good as of if EDPD is on Thursday, probably the Friday before or the Monday before the EDPD. So if you submitted an invoice after that date, it won't show up on the document that you get for EDPD. But I would just like to go over, I don't know if you guys see it, it says example 1. I would like to go over that real first. So for example 1, that voucher number that you see there is internal to us, so you don't even have to worry about that. However, your voucher date is the date submitted. The invoice period and description is usually what you'll put on there. That's what that voucher covers. And I had to blot out the invoice number, but you notice that it's the same format that you guys have. The last digit or two will change depending on how many invoices that you have submitted. The invoice type is usually a STD, which stands for a standard invoice submitted to our supplier, or it could be a debit, and I'll explain that in example 3. You'll then have your invoice date, meaning the date that you submitted it to us. You'll have your approval date, meaning the date that finance, I shouldn't say me, because I'm fiscal, the date that finance actually approved it and put payment out. And then your status. So you will have like 1 or 3 options. So A is actually approved. C means it's been rejected or canceled. So rejected can be rejected or canceled could be 1 or 2 things. You actually ask for it to be deleted out because you made a mistake, you're gonna redo it over, and they do it. Or in example 3, if you see in that line item, you'll see that it says DBT. So the original voucher was put in for $376 odd. Well, DFSS said $62,000 odd was rejected because they couldn't justify, what that 62 amount was paid for. So when you look at it, it'll say what you originally submitted and if there's a debit memo on there. When you get your debit memo, it'll usually give you a code that'll say why. I don't have that on this sheet here because that's individual to the memo that you get in the reasoning. So then you have the amount that you submitted. The next column says the amount that was approved, and then the amount of your payment. The last column will let you know if there has been payment sent out or not. So it'll be yes for payments been sent out, or no, payment has not been sent out. One of the things that I wanted to make note here, like I said, this is a cut and paste because I wouldn't have been able to get the whole document on there. But for example 3, you see this agency submitted an amount and there was a debit memo on there. However, when the agency resubmitted that amount, and it could have been finance just wanted approval from CSD, is this allowable? We said yes, you guys resubmitted the invoice. You'll see that at the end of that invoice number, it says RJ because it's a revised invoice of a previously submitted invoice. In this example, when you go through, you'll see that finance hasn't reviewed it yet, but I just wanted you to know that you'll be able to see what you submitted, regardless of whether there's been payout or not. And if I missed anything, I'm sure Frederick will say something in his presentation, but I just wanted to be able to explain the document that you guys will be getting now, since it won't actually be the letter that you guys have been getting before. And so next slide.
All right, as I said, thanks, Angel. As I said earlier, we're continuing with training. And so what we want people to do is continue to look in the CSD update to see what trainings are up, what the training links are so that you can get your staff registered or yourself if you need training. but also reach out to staff members here at DFSS, CSD, if you have any questions or need any assistance at any time, because we want to make sure that everybody has the ability to do everything that they need to do while working in the system. I did see one message in the chat. I need help moving kids from the wait list. And what Craig is responding, he's going to have Jennifer work, or with Craig, they will be reaching out to you, Jewel, to help you with that. Is there a timeline or finding out about the workforce scholarships, Chicago Early Learning Workforce Scholarships? William, are you on it? If so, can you respond to that question for me? You can do it in the chat. But please respond to that one. But again, it's making sure that everybody has the training that they need. I want people to make sure that they're comfortable, not only with you being comfortable. Many of you will have a new staff that will start. You need to make sure that you have enough of the information about the care system, for example, so that you can get that person started in the system as well. And so we're just going to make sure that you have what you need. Lean in on us and let us know if you need more or what we need to do to make sure that you feel that you're going to be effective in this system. Very soon, we'll be at the end of a program year. In August, starting again, we'll do a whole nother rollover. Well, when we do that, you will not be doing anything in COPA. Everything will be in CARES. And we want to make sure that nothing gets lost in translation. So I'm just hoping everybody has participated in trainings. You've had your staff participate in them. There's more training again in the month of April. But no, they will be continuing to work and offer opportunities to get information. There's also information that's on the site when you sign on to CARES. There's that hub there that has updated information. All of the links, all of the trainings, all of the documents are there for you and your staff. And so it doesn't go away. It's there for everyone. So if somebody just needs to go back and do a refresher, meaning look at a video or get a document, it's on the front facing part of your care system. And you can link onto that hub and get that information as well. I'm looking to see if there are any other questions in the chat that I'm missing. I think that was the last slide. Go ahead if there's another one. Go ahead. I've got Frederick, I think you're on. Are you doing financials?
Yes, yes.
All right, it's turning over to you.
Yeah, good morning, everyone. Just here to give an update on financials. First with the federal grants. Head Start, we're at about 14% early Head Start, 10% early Head Start CCP, 10% early Head Start expansion, 9%, and we should be around 25%. So please keep vouchering and getting those invoices in. Next slide. With the state updates, ECBG, we're at 40%, and CCAP, we're at 42%. We want to be around 67% on those numbers. Finance Department updates with the federal grants FY24. All December 23 invoices should be submitted at this time. If you're experiencing any issues with submission, contact your finance accountant immediately to determine accrual need. Failure to submit your December 23 invoice or report accrual can result in loss of funds. Invoices through February 29th period coverage should also be submitted by this time. FY24 child care invoice should be submitted through February 29th period covered. As it relates to the PIPFA, all January through December 23 invoices should be submitted at this time. If you are experiencing any issues with submission, contact your finance accountant immediately to determine accrual need. Failure to submit your July through December 23 invoice or report accrual can result in loss of funds. Invoices through February 29th period should also be submitted by this time. Important updates, add to your calendar. Budget revision deadline is 5/15/24. FY24 invoice submission deadline is 7/22/24. Please do not wait until final deadline. Advanced preparation and submission is strongly encouraged. And supplier, make sure your insurance is up to date. That'll hold you from receiving your reimbursement. Keep your iSupplier contacts up to date in order to receive proper communications from vets during their review, invoice review. Per requirement, contract requirements, invoices should be submitted at minimum monthly. Review your iSupplier frequently to reconcile and determine any submissions, resubmission needs, and its training material, reference material at the link below. Your finance contacts, any of your federal agreements, reach out to Laverne or Teresa. Your corporate and RTL, Laverne and Teresa. Childcare is Selena. Your PI, PFA would be Laverne and Teresa. Fiscal Fridays, or is this me or? someone?
That's Claridine. Thank you, Frederick.
Okay. All right, thank you.
Hello, this is Ken McGee. Can you guys hear me okay?
Yes, we can. Thank you.
Okay, good morning, everybody. We are continuing with our fiscal community of practice, and we had our last one last week, and we encourage folks to get on board and to sign up and to attend. We're having rich discussions around more based on system navigation, as well as finances providing updates and CSD fiscal as well. So if you or your fiscal staff has not attended, the next one will be the third Friday in April. So I encourage you to register and to attend. You don't have to attend all of them. You can drop in when you can. But I think that dropping in would be beneficial for you, especially if you haven't done so yet. And also, agencies are also providing us with advanced questions at times, which we're trying to address. So once you register, you can also put in if you have a question too about something that you're trying to navigate, and it goes in hand with the support that Angel was talking about earlier, and also you being able to try to meet some of the objectives that Frederick was talking about as far as meeting your expenditure goals and being able to think about how you can make the deadlines too. So it'll be really beneficial to join. Yeah. Yeah, we can put the link to the registration in the chat box. I'll do that momentarily. And also the link is being posted every week, every time the CSD updates go out as well. So as you scroll down in that email that you're getting from Mara and her team, the link for registration is also there too. That's my report on that piece. Yeah.
Thanks, Ken. Trying to see if there's any hands up. I'm looking at questions in the chat. You're going to put in the fiscal practice information in. Question about ECBG. The Early Childhood Block Grant, also our federal funds that would normally be out in an RFP by now. We did extend it 1 year. We're looking to try to get the RFP completed and out as soon as we can toward the end of this year, first of next year, in time for grants to be effective July 1 for the state grants. And so we're working, what we're waiting on now. There's discussion around the RFP, and until I can get everything confirmed, we can't finish the work around putting the RFP together. So once those conversations are completed, then we'll finish working on the RFP itself. We'll be having meetings as we did before, talking to all of you about the RFP before the RFP is completed and actually signed and everything is done. We'll be having conversations. There'll be information going out to let you know when it's going to be launched, making sure you know where to access it, et cetera, et cetera. So all of those things are going to come up when we get a little bit further down the road about the next RFP for the Chicago Early Learning Funding that comes out of DFSS Children's Services Division. So more time still on there. Your contracts are currently active. through June 30th of this year. They will be active for July 1 through June 30th of next year, but by then we will have had to have gotten the RFP through the process so that we can do the new awards. And so we've got just a little bit of time. It takes about a year to get an RFP done, so we're under the gun right now. But as soon as we know more, we'll definitely be having conversations with all of you so that you know exactly where we are and what to expect next on the RFP. I'm looking in the chat to see if there are any other questions that we didn't answer. There was one about finding out about the time frame for scholarships. William, do you want to answer that one for me?
Yes, sure will, Soreto. And I did provide that to directly to the person that asked that question. So our scholarships did open this past program year in this year in January, and right now we're working with our partners at INCRA that completes the vaccine. And again, we received over 1,000 scholarship applications within the open time period to apply, and so therefore INCRA is working through. Again, I did send directly a direct message to an individual to ask that question, and we're going to do some talking offline. Provide me the list of any of your staff members that you know of that have applied, and all I can do is provide you kind of with to ensure that they are receiving correspondence from ourselves workforce scholarship team, and then also can probably provide kind of where they are in line. But I do know that typically there are automatic emails that go out every 2 weeks, letting them know that we have received their emails or we have received their applications and they are indeed up for evaluation. And so it just takes a little time to vet that amount of applications. And then I also did put my email address in the chat box for any further questions.
Great, thanks, William. There was one asking about the class. I had mentioned the class observation federal review that we're going through right now. We are winding down. We've got only 2 weeks and a day, meaning Friday of this week, before we will finish with our class observation. It ends on April 8th. So we've got a couple of more weeks to go. Staff are out and about in classrooms doing the video recordings. We're reviewing those recordings. We're approving those recordings and sending them off to Office of Head Start for review and approval. So we're still in that process, and it will go through all the way until April 8th. And then we will anticipate getting a response regarding the review about 6 to 8 weeks after the closing dates. I'm looking at the chat to see if there are any other questions.
I have a question.
Go ahead.
Okay, so I was wondering if the daily schedules for our classroom were shared with the class support that were coming out to the classroom. And I'm mentioning this because one of our person that came in at around 10 o'clock, right? By the time she settled, maybe about 10:15. And then she requested us to extend our morning work cycle further. So the children were restless. They knew it was recess time, man. It just made it such a difficult day. It threw everybody off. It threw the teachers off. They were bouncing off the wall because they knew it was recess time.
Right,
so
right.
It was just, I don't know. I just wanted to throw that out.
Okay, well, no, thank you. Thank you for letting me know that, Jacqueline. We're going to actually add those of you who are in the midst of this review onto our Friday meeting. So you're going to get a link shortly after this meeting for Friday discussion. I'd ask you at that time to be on there and let's talk about that, Jacqueline. Okay.
All right. Thank you so much.
Oh, no, thank you. Seeing no other hands raised, our non-Head Start funded program directors and teachers, can they be trained on class? And I know we have done class. I know we are doing more class, and it's across the board. Now, we federally funded are required for us to have what we're going through right now, which is this class review. But we've opened up trainings and professional development around class for everyone. And so, William, if you want to speak to that, I'll be quiet and let you talk.
Thank you so much for that, Soreto. And yes, you're absolutely right. We do work with our partners over at Teachstone to provide class trainings across the gamut for all of our funded programs, not only our federal programs, but our state. And we also do infant and toddler as well, not only just pre-K as it relates to our state-funded programs, because that is that is something that we like to see across our PI programs. And again, I did put my email in the chat. I would definitely like to follow up and just ensure that you do have access to our PD brochure and our PD booklet, and that is where all the trainings live. I know it comes out in our CSD update, but then also it comes directly from my PD team, Kayleen. I can put her email in the chat as well, so that therefore, if there's any questions around PD offerings, we can make sure that you are on the list to receive that pamphlet or that booklet in which we're housing all the registrations right now that you can access to participate in any trainings for you and your staff.
Thanks, William.
More than welcome. Thank you.
Thank you, Rita. Yes, I had mine already. She put out a shout out for the shingles vaccine for over 50. So those of you over 50 know what Rita and I have gone through, knowing that, you get to a certain age and the shingles vaccine is really necessary. And it is important, especially around this time, because what it will do is it will rear its ugly head if you have not had that shingles vaccine. So not pulling anybody out there about being over 50. I am over 60. And so making sure that we're taking care of our health, that we do what's necessary and required for us on our vaccine side as well. Thanks, Rita, for putting that in the chat. We need to do what we need to do for ourselves to keep ourselves healthy and safe as well. I'm sorry, what information would you like as well? I want to make sure that we're giving you, is that regarding the PD? Because if it's regarding the PD, it will be back in the CSD update, and we'll make sure that everyone gets access to it so that you know exactly what trainings and everything that are available to you. So thank you. Absolutely, Anita, we've got to do self-care and we've got to model it. People don't, if we're not talking about getting our vaccines and doing what we need to do, it's hard for us to tell other people to do it because people will follow what we lead. I see your hand up, Olivia.
Yes, typically when we meet in person, you guys give us the paper, letting us know like where we're at as far as the billing.
Yes.
How can we get that to know like where we are?
It's going to be emailed because we're virtual. So staff will be emailing those same documents out to you.
Okay.
All righty.
Okay. Thank you.
Oh, you're welcome. Anyone else have a question before we give you a little bit of time back in your day?
I got one more question.
Okay, go ahead.
Last time I came, because I'm the site director or whatever, I just want to make sure that I get that email because to make sure our financial team get the email so we all be on one accord.
Okay, so you want your email address on there? If so, put your email in the chat and our staff will grab that and make sure that it gets included. Say what agency and put your email in there so that they can add it.
Okay, thank you.
Oh, thank you. Anyone else? Well, we would want to thank you. I captured the links that were put in regarding resources for parents out of the chat box. And so those will go out in CSD update as well. The information that Sheree shared will go out and we'll make sure that we put other information in there for example, the PD booklet and how to get access to that. So we want to make sure that we're keeping you in the loop on where things are and how to get to them so that you and your staff can always get the upfront personal information that you need. And we definitely want to make sure for those of you that are on the call that you have what you need so that you can share it with others, because that's what we're asking is be here, but be sharing because everybody couldn't make the call. We recognize that. So more information will always go out in our CSD update. And I'm hoping that everybody is looking at that. The trainings that we're doing, the community of practice that Ken talked about, the information on vaccines, et cetera, et cetera. We will be making sure that we keep things updated and going out constantly so that you're able to keep up to date and see what's new and what you need to be working on. And so if you're getting in, make sure that we have the correct information on your email. If you're not getting the email, what I'd ask you to do is send me your email address so that we can make sure that it gets added. I'm going to give it directly tomorrow where everything comes out from, but you can definitely send it to me. And then I'll make sure that things are going to the correct email address for all of you. So don't hesitate to send me an email to make sure that your information gets updated. Any other questions? I don't see any other hands up. Want to give you a little bit of time back. I just want to thank you for being with us and spending time. I hope this information was helpful. Hopefully you got something out of it you can use either personally or at your sites with your families and with your staff. So everybody, thanks again. Have a great rest of your day. Stay safe, healthy, and be well. And we'll talk to all of you soon. Take care, everyone. Have a great rest of your day. Bye-bye.